Hello, hello. So, we are talking about the pros and cons of telehealth or telemedicine. I'll be using that term interchangeably today, but when you should and should not use it. We're going to talk about that because I know that you want a faster and more convenient way to reach your doctor. So, telemedicine must be the answer, right? Or is it? Because let's face it, when you are sick or if you have a question, you don't want to have to wait all day and do all the things to be able to go in and see your doctor just to get that answer. You want to feel better, have your questions answered sooner rather than later. So it is fast, it's convenient, but I must be honest, there are some issues with it. So I want to make sure that you are able to use it effectively. So we're going to talk about that. We're going to talk about the pros and the cons of using telehealth and telemedicine, when you should use it and how to get it to be the most effective for you and to get the answers that you need. So if you are new here, hello and welcome. If you have been with me for some time and you say, I'm not new to this, I am true to this, either way, welcome and hello. I am Dr. Ashley Booth. I am a board certified family medicine physician, and I provide practical health tips and tools that you can use in your everyday life, because what I understand is your life affects your health. Now, go ahead and do the things. Subscribe if you haven't. Turn on the notifications so you don't miss anything. Follow, and then sharing is caring, because we all have experienced this or know someone who will, or you're thinking about using it and you're like, should I, shouldn't I? Let the people know. She's going to tell you because she's a doctor. She has used it, plus she has also helped her patients navigate this. So tell a friend, share them, let them know that I'm talking about this live. Put your information in, let me know that you are watching so I can say hello, or throughout, if you have any questions or comments, let me know, because I want to know what is of interest to you so that way I can serve you. So let's get into it. Now, what exactly is a telemedicine visit? And that is essentially any time you do not have to go in to your doctor's office. So that can be a phone call, it can be a text, or what we call, some of them have like chats. You can do like a little, open up a chat and interact with someone that way. Email and video visits. A lot of people thought, oh, it's just video visits, but it's any of those things. Anything where you don't have to come into the office is technically considered a telemedicine or telehealth visit. And it really became popular during COVID because people are like, the doctor's office is where people get sick. I don't want to go where sick people are, especially with COVID. So I'm going to stay home. However, I'm still sick or I still have some concerns. So then it's like, well, what do? You don't want to go in. Well, how do we still serve you and make sure that you're okay? Then this was the other alternative. And so it has really exploded, and a lot of people want to use it. So we're going to talk about how to use it appropriately today. Now, the two things that I want to address before we get into the pros and cons of it is that the first thing is your doctor may use it the way that they seem fit, which means that some people may use it for acute visits. Some people may use it for chronic visits like high blood pressure, diabetes, those kind of things, and following up on that. Some other people, like I said, the acute visits, I have a cough, a cold, feel like maybe I have a UTI, those types of things. But your doctor may choose how they want to do it. They may choose the way that they want to do it. They may say we do it on a phone call, or we do it with a video visit. So know that it can be different for each person. The other thing, the second thing, is that you may be charged for it. So be aware of that. During COVID, a lot of things were lax and stuff like that. Now we're putting more structure around it. So know that even if you're doing it with your doctor's office, there could potentially be a charge for it. For instance, if your doctor's office covers this an acute visit, more than likely you will be charged for that, and they will charge your insurance. But usually it's cheaper because there's not as many things that they have to do. So a lot of times it can be cheaper. But the other way that it can sneakily catch up on you, and you may not be aware, is those my chart visits and those patient portal messages that you send. So when you go in my chart and you want to talk to your doctor about something, you go into your patient portal, you want to talk to them about something, now that can be considered a telemedicine visit and you can be charged. So be aware of that. And you may not notice the charge until you get a bill in the mail. from your insurance that says that it's been charged, and you may not ever have to pay for it depending on your insurance, but be aware that sometimes you can be charged. You may also have this service available to you on your insurance. So your insurance may say, okay, if you go to our telemedicine providers, it may not be your doctor, your regular primary care that you see. It may be this whole different company of telemedicine doctors, and that's all they do. They say you may be able to use this service and it's a part of your insurance plan. However, know that there may be an additional fee that may be associated with it. So just be aware that one, your doctor can choose to use it however they seem fit, acute or chronic visits, or a video visit versus telephone, whatever, and that you can be charged. So those are the two things to be aware of. Now let's talk about the pros, okay? The good thing is it is convenient, because at the end of the day, when I don't feel well, and by I'm talking about myself, if when I don't feel well, I don't really want to get out of my bed and do all the things and then have to come into the office to get evaluated and stuff like that. So it makes it very convenient. Also, it's good for those things where people say, I have a quick question. Sometimes those questions aren't that quick, but there are some that are. And so if it's just a quick thing, it's going to take a little bit of going back and forth a couple of times, but that's about it. And it gets it answered. That makes it very convenient. It saves you time because, again, you don't have to take off from work. You don't have to drive to the office, go into the office, spend time there, then drive back to wherever you need to go. So it's going to save you a lot of time. Money. It can save you some money because, like I said, these visits are typically cheaper than your regular in office visit. So know that that is one of the perks of it. And then increase access, because if we are honest, if I know that I have someone at my fingertips and I can ask them a question real quick and they're going to get back to me, I'm more likely to ask them versus calling the office, staying on the phone, getting an appointment 3 weeks out, then coming in and then talking to them about that, right? So is that question that serious? I don't know. Maybe I'll just figure it out myself. So it increases your access to be able to get the answers to your questions a lot sooner. But here are some things I want to caution you about, because here are the cons of it. And that is, it may not be appropriate for every type of visit. It's probably not appropriate for every type of visit. For instance, I've been noticing that there are a lot of telehealth companies that are popping up, like I said, and they do all these different things. And there's one or two in particular that I know that they don't do any face to face, they don't do any phone calls. It is just a chat. And you chat and you tell them, I don't feel good. And they say, what's going on? Then you say this. Some of them even have a template and you just click, click, click. And that is okay to a point, but sometimes it may not all match up with what's going on with you. It may answer a few of the things that you have going on, but you may also say, but this is also happening too. And you may need to explain that, but sometimes those chats don't do that. The other things with chat or text only is that a lot of times things get lost in translation. Think about it. You may have sent a text message to your friend and the tone of it from your standpoint was like a ha ha, jokey jokey or whatever, but then they don't respond for a while, and then you're like, well, did they get the joke? Did they realize that I was just joking and that wasn't serious or whatever? Or someone can send you a message and you read it and you're like, what? I think I understand what they're saying, but I don't know. So a lot of times things can get lost in translation, and it's like, I just need to pick up the phone and talk to someone, or I just need to do a video visit, that sort of thing. It may not be the most efficient, because think about it. If you're texting back and forth and you have to give them a lot more information, you're going back and forth. You text them and then they text you text them and they text you. It can take a lot of time. I've had that happen before. Some people will send a text. They'll give me some information. I will text them back. They'll give me some more. The information all doesn't quite make sense. And I'm like, do you have a moment for a phone call? And they're like, yeah. And then I call them up. I go through, I say, you said this. I just need to clarify, blah, blah, blah. We go through it. It takes less time. And then we're good to go. And I understand what their issue is. And then it gets resolved. So know that some of those methods that they have, especially those chat only, I want to caution you about using the ones that are just chat only. You just type in your information, because they may not be getting a full clear picture as to what's going on with you. The other thing is issues. So you may have some issues that you've been dealing with for a long time. Like, it could be like back pain, but back pain that's been going on for 6 weeks. Well, that's something that needs to come in. If you're talking about ear pain that you said that's been going on for more than 5 or 6 days, probably need to come in and take a look at that. Some people are like, oh, I think my blood pressure might be going up. I checked it at home and I saw it doing this a couple of times. If you don't have a relationship with that doctor, you've never spoken to them about it, and you've checked your pressure and then you checked it at home and then you think, oh, I may have high blood pressure, that is not an appropriate visit. So that is not the appropriate time to say, okay, yeah, I want to use telemedicine because of this. That's the time when you need to go in. Because the other thing is, we are not able to do a full evaluation through the chat. They are very limited through the chat, video, telephone, all of them. We are very limited on how we're going to be able to treat you and diagnose you. Sometimes you just have to come on in because we need to do labs. So we need to do some urine or some blood work or some swabs. A lot of people are out there not feeling good, achy and stuff like that. So they're taking COVID tests and all that. So you may also need like an RSV or flu. Those things you may not have at your disposal. So you need to come on in and get those checked out. The other thing are vitals. We still like to do those: blood pressure, your heart rate, your weight. Those are some things that'll go into the full picture to help us figure out exactly what's going on, to figure out how do we need to treat you and what do we need to do. We need to listen to you and we need to see you. So you need to come in, because sometimes I can see some people, I'm like, oh, I can tell that something is off already. Or I need to listen to you, hear you say the words of what's going on, but also need to put my stethoscope on you and listen to you that way. I need to listen to your heart. Is it beating fast? Is it skipping a beat? I need to listen to your lungs. There's some people who told me, you know what? I'm not feeling good. I'm just coughing. I think I'll just need some cough syrup or whatever. Some of those people say, I'm going to come into the office, because I said, are you wheezing? No, I don't think so. I said, come on in. They said, well, I'll come in the office because I have some time. They come in, I put my stethoscope on them, and not only are they are wheezing all throughout. They have no idea, and they sound pretty bad. Then I give them a breathing treatment in the office and they feel so much better. And I was like, yeah, but they don't have a history of asthma. They had a cold, but that cold caused what we call bronchospasms. And so now they're not able to breathe and they have that wheezing. So the air is not moving through as well. So sometimes that's why you say, well, that probably didn't work if you did a telemedicine visit, because there's some other things that could be going on with you that you are not aware of. So some of the main tips that I want you to kind of pull away from this today is: one, don't use it to replace your going to the office. Okay. You want to go in, we need to see you at some point. Because I have some people that say, I'm good. And I was like, yes, but I need to see you. So you need to go in at least that one time so they can, especially if you're relatively healthy and everything is fine, you still need to go in at least once a year, let them do that physical so they can look, listen, make sure everything is okay, right? You want to make sure that when you set up these telemedicine appointments, that you are ready. You have to be ready. I know that because you're in the comfort of your own home or car or wherever you are, you feel a little lax and it's like, oh, well, I'm taking this medicine. I think I might be taking this. No, you want to have all of your stuff together so that you can really make that visit efficient. Have all of your medicines that you've been taking right next to you so you can say, I'm taking Mucinex DM, and says that it has so and so and so and so and so and so in it, or whatever it is. And if it's a video visit, you can show it up to the camera so the doctor can see the ingredients, because all of these different medicines have different nuances in them that do different things. And so we need to know which exact one are you taking, so we'll know what we can add or what we need to take away. The other thing is, when you're doing these, understand it is still a visit. So you want to be in a private, quiet location, because a lot of us are concerned about like HIPAA and your business being out in the street and stuff like that. So I don't want you to be out at the grocery store all willy nilly having a doctor's visit and talking to these people about all the things, because they may be asking you questions to confirm stuff. Okay, are you still taking this? Are you taking that? And everybody and their mama know what's going on. You don't want that. So make sure that you're in a place that's quiet, so you can focus, you have no distractions, but also that is private so that other people aren't listening in on what's going on with you. And then the last thing, if you are not getting better, go into the office. This is not a time to say, well, I'll just call up and do another telemedicine visit. Something must not be going on, something may be missed. And again, that is where that whole art of medicine comes in, where we need to listen and look at you and fully evaluate and say, ah, that's what it is. So then you want to go in. If it's not getting better, you've taken the medicine, you've done the things, you need to go in and see someone. Now, at the end of all of this, I want to let you know that we offer telemedicine visits. We do chat, email, video visits, phone calls, and it is all free and it is all included in the membership. So people are able to kind of contact us the way that they need to, and we make it flexible. But we also know the people who are contacting us, so then we can let them know whether or not this is appropriate. So some people, they're like, I have this going on. I'm like, oh, okay, yeah, I just talked to you about this over the phone, and let's do a video visit so I can take a look and see what's going on. Or they tell me something else and I say that's not appropriate for a telemedicine visit. I need you in the office. Can you come in today? So when you're using that telemedicine, you need to know, are you dealing with the right people who know when it's appropriate for you to use it or when it's not? Some of these programs will go through and you get so far down, they may say, oh, you need to go in or whatever. But understand that all of them are not created equal. All of them may not give you all the answers that you need. So then that way you can use it the best way that makes sense. So if you are still looking for a healthcare provider, primary care, we're still accepting new patients. And as I stated, we are having those telemedicine visits that are all included in the membership so you can get well the way that you need to. So you feel free to look us up. I have the website and the phone number that's listed there. But until next time, I will see you soon and take care.